understand that this morning Dean talked a bit about compassion, and I suppose for those of you that know me or have heard about any of the work that I've done since I was appointed as CNO will know that compassion in practice, the 6 C's. How many of you have heard of the 6 C's? Excellent. Will know that that's something that I'm really passionate about. But I thought I'd start off with these slides and just point out that compassion is everywhere, and it does seem that we do seem to have suddenly become the buzzword in the NHS, and I feel quite strongly that actually compassion in practice as part of the 6 C's and things was before Francis reported and before it's been something that the government have talked about a lot. But these pictures just really identify, I think, how compassion is everywhere, and whether that's in, you know, the sort of compassion and love between a mother and a baby, whether it be in art, whether it be families, whether it be with strangers, or even whether it's in the middle of a battlefield, you see compassion and you see that empathy with others wherever you look. And so it's not new. It is absolutely not new. I also thought I just wanted to tell you a little bit about my own story. What drives me to do this job? I was lucky enough last week, invited by Dean and NHS employers to go to Clarence House on the day of the Nursing Times Awards. So about 100 of the nurses that had been, sorry, I just spotted one of the care makers, had been shortlisted for Nursing Times Awards. And I was lucky enough to go, and they sort of got me in the lineup to meet Prince Charles. And he said, and as I got introduced as the Chief Nursing Officer for England. And he looked at me and he said, I can't do the accent because it's too posh, but he said, did you volunteer for that role? And I said, yes, I did actually apply for it. He sort of, are you mad? You know, are you okay? Is it a bit busy? So I said, oh, yes, it is. And I thought, I did actually apply for, I did actually go through a proper process. But anyway, but it was just interesting to hear that type of response to when I got introduced. So what did start me off? Well, this is a picture of me. I gather you saw Dean's grandson earlier. So I just wanted to check, how many of you actually made the point that he looked too young to be a granddad? No. Excellent. I've won the sweepstake then. Because there was a lot of us that said he only did it to show that. Now, this is me as a child, and some of you know how old I am, because I've worked with at least a couple of people in the room. But I think the fact I'm wearing a knitted suit gives it away, really. So this is me as a child at my home in Bristol, where I was born and brought up, and some of you will pick up the accent. This is me and my brother David. Dave and I are incredibly close, have been for a very long time. And I used to practice being a nurse with him. And I put this photograph up because I'm not sure how on earth I got ringlets in my hair, because my hair is dead straight. But because I actually used to play with Dave, literally practice on him and bandage him and do all sorts of things that you do as a child dressed in a nurse's uniform. And he's still frightened of hospitals and doctors and nurses, and still can't take tablets and still has to ask for them to be given to him in liquid form. But I think it was I had one of those classic children's sort of upbringings where I really did want to be a nurse as a child, and then I sort of went off the idea as I became a teenager and got into punk and wearing lots of black eye makeup and stuff like that. But then my mum became quite unwell when I was a teenager, and so I was in and out of hospital with her a lot, and I saw what nurses did. I used to watch them treating the patients and caring for people, and it really made quite a difference to me as an individual. And I went from wanting to, bizarrely actually, I'm not quite sure how I went from being a nurse to this. I wanted to do French, and I still love French. Wanted to do French, I wanted to work abroad, I wanted to do anything that got me into the sort of business French world. And then as a teenager, going in, I was about 15, 16, going in and out of hospital a lot, my mum completely switched back to being a nurse and actually got told by my head of sixth form that I clearly didn't want to be a nurse, and I really didn't know what I was talking about, and I needed to go off and do something completely different. And actually, I was on an ego trip, and that's all nurses were. They were only on ego trips. I took great delight in going back to see the sixth form college many years later, after I'd been appointed as the director of nursing. But anyway, I did it, and this was me on my very first shift, going to work in the local A&E department as a staff nurse on my very first shift. Again, you can tell the age. My Farrah Fawcett hairdo gives it away. I'd just like to point out to those of you that think I didn't go actually with my hair down past my collar. The other thing that I find quite amazing from that is in those days I had a 22-inch waist. I'm not quite sure where it's gone, but it certainly went a long time ago. And that's my parents' bedroom. And although they have changed the curtains, which would vary in the 1980s, they've still got the same wardrobes. So I started nursing when I was 18, qualified, and did pretty well. Came top of my year and top of the across the country. Actually, I did really well in my exams, but I absolutely loved it. I'm passionate about it, and I still am. You know, some people say, don't you miss it? And yes, I do miss frontline nursing sometimes, but I do still do it. I still go and volunteer as a nurse with sick kids at the charity that I work for every year, and I absolutely adore it because it means I'm actually back doing. The kids don't care that I'm the chief nurse for England. They know me as Nurse Jane. Some of the nurses that I'm also working with, we have a little bit of a panic when they realise that I'm part of their team. But after they realise I'm actually quite normal, they're okay. But I still feel that passion for the job now as I did when I was 21 at that picture. This photo is my brother as he is now. This is this summer, and my two nieces. And the reason I put this photograph up, and similar, I think, to probably what you heard from Dean this morning, one of the things that drives me now is about creating the NHS for our kids and for our future. I haven't got children of my own, so this is the nearest I've got to my own children. And I absolutely adore my two nieces. But for me, whatever I'm doing now, whatever we are doing now, is creating the NHS for the future. And we need to concentrate, I think we need to concentrate on that and actually making sure that what we leave behind is fit for purpose and the best it possibly can be. And then the last photo I've got up here is this is my parents. Despite my mum being in and out of hospital so much when I was a teenager, she's still going well. She's in her 80s. My dad is in his 80s too. My dad spent years looking after my mum, and it's now complete role reversal. So when we talk about our elderly relatives, as many of you will have, and many people will know elderly people in these cases. My dad now has early dementia. He has carers that go in every day. He's got a lot of multiple long-term conditions. He is the classic vulnerable older person that we spend so much time talking about, trying to really help and try. And so for me, what I'm doing now is also vitally important for the here and now, for the older people that we are dealing with day in, day out. And I want to do everything I can to support my dad to be looked after at home for as long as possible. The other thing that I often put up is the NHS Constitution. Now, I usually ask an audience, do you know about the NHS Constitution? And it's surprising how few people do. I won't ask you because I'm assuming that everybody will put their hands up. But this paragraph particularly has an impact on me, and that last sentence around it touches our lives at times of basic human need where care and compassion are what matter most, was really the driving force for me for developing the 6 C's and compassion in practice. And I remember going for my interview, or part of my interview process for this job, and I had to do a presentation to 50 frontline nurses. And I developed my presentation, and I developed a lot of it around the Constitution and around what was then 4 C's. And I walked into the boardroom at Quarry House feeling particularly nervous at going in to talk to 50 frontline nurses. And I felt really, but I also felt quite proud of myself because I had the Constitution slide, and I thought, that's really good. And I walked in, and it was emblazoned across the wall. And I felt a real twit, actually, because I thought they'll either think I'm, like a real creep, and I've only put it on the slides because I know it's on there. But to be fair, I managed it, and I did keep going. And I managed to get through this, and obviously it helped because they contributed to the decision about my appointment. But I think this is really important for me, and I think we don't do enough, any of us, to really think through what's in the Constitution and spread it and make sure that not only our patients know about it, but our staff, because the staff pledges are really important. And I thought, I got to put this Ipsos Mori poll up. I don't know about you, but I won't buy the Daily Mail, but we do get, one of the things we do get is circulated every day is a list of all the media coverage. And it does get quite depressing when you read consistently about the poor news stories. So it's really nice that 71% of people say that Britain's National Health Service is one of the best in the world, from Maury. And it's also really good to say, what makes you proud to be British? Actually, more people say the NHS than they do about the armed forces, than they do about Team GB following the Olympics, or they do about the royal family, for example. So I suppose that, and the Don Berwick comment when he was over doing the patient safety review, that said, excuse me, that said, you know, this NHS is one of the best in the world and can be the safest, is something I think we need to remember, because it's so easy at the moment to get fed up and depressed by some of the negativity that we see. So I will talk a bit about nursing. It really is from cradle to grave and absolutely everywhere in between. And the 6 C's that were developed and the values that I think are so important. For me, oh God, I knew this would happen. Last night I had no voice at all. For me, really encapsulate. I've got water here. Oh, yeah, I have got some. Really encapsulate what we're here to do. But one of the things I think that I would want to reiterate. So you could say, I'm talking to. I mean, I can see there are some nurses in the ring, but most of you are HRID professionals. These values are the same for whoever you are, whatever job you do. So this is not about nursing and midwifery. This is about everybody. And one of the things that I find that's been the most motivating for me as an individual as I walk around and I go to see so many places is the number of organisations that are adapting the 6 C's for the whole of their strategy. They're using it for their induction for all members of staff. They're using it as part of appraisal for all members of staff, not just nurses and midwives. And I think that's for me has been really powerful. The other thing about the 6 C's I thought was quite interesting. I went to a conference in Worcester last week, University of Worcester, and Jan Collington, who's one of the lecturers there, has done some work on service user and carers' expectations. And this was done before I published the 6 C's. But as she described some of these areas, I thought it fits. It really does fit. So whatever you do in our service, whatever job you do, actually having these issues where you put patients first, you're kind and compassionate, you are emotionally intelligent, loyal, dependable and honest, competent, responsible, is actually as equivalent to a nurse and a midwife as it is to an HR director, a porter, a cleaner, a chef, you know, a receptionist. So I think some of that for me was like another backup to what we're trying to do. And I won't repeat all of these because you will know them. We've been reviewed to death. But every single one of these reviews has got elements in it that reflect what we've put in compassionate practice and reflect the 6 C's. And that, again, I think is really important. I didn't know what was going to be in the Robert Francis report when I did and I published Compassionate Practice last December, but it was very useful to see that not only were some of the recommendations that we'd made repeated in there, but a lot of what was written in that was reflected in what we'd set out the previous December. And we've got 6 action areas. Each of those action areas are led by an SRO. And the point about these action areas, I think, is that you can't do just one of them. You do something in all of them. And we've set them up specifically to have individual action. So individual members of staff can take action to support each of these areas. We've also got organisational action and we've got national action. And the point behind that is really being, I can't change the world on my own, but I can have a significant impact as CNO. But if we do it together and we all take action in our own ways, we can have a really significant impact. The other point about these 6 action areas are that they reflect where we think will have the biggest impact. And so looking at working with patients to have a positive experience of their care is so important. Listening to what patients tell us, listening to their stories, listening and learning, taking action is absolutely vital. Making sure that we build and strengthen the leadership at all levels is also really important. And I often say that it doesn't matter what job you do in the NHS. It doesn't matter, and if you're a nurse, it doesn't matter whether you're a band 5 staff nurse on a ward or in the community, or whether you're a director of nursing or a ward sister charge nurse. Whatever you do, you've got a leadership role. You make decisions that impact patients' lives day in, day out. So whatever job you do, you have a leadership responsibility. And I think building and strengthening that really is really important. Action Area 5 is the other one where we're doing a significant amount of work. And we will publish some staffing guidance very soon. And that will talk about not only getting staff with the right numbers of staff and how you can work towards determining that, but actually supporting the staff you've got. And I'll come on to talk about that in a bit more detail. So for me, having the numbers on their own are just not enough. You will see things all over the place about minimum staffing levels. We must have a number of X to Y. The most important thing is, yes, you clearly need to have enough people, whatever job, whether that be enough doctors, enough AHPs, enough support staff, enough nurses or midwives. But having the right culture, the right environment, the right support, the right education, the right openness and transparency and ability really makes a difference. And that's where people like you play such a vital role in actually delivering this. So I just wanted to spend a little bit more time talking about Action Area 6 and positive staff experience. And this is led for us by the one and only Dean Royals, who actually volunteered to take the leadership of this one, which I thought was really, really important. And it actually, for me, spoke so much about this is not just a nursing issue. This is about a whole community, a whole staff issue. So Dean leads it. I could say he's become an honorary nurse, but I'm not quite sure whether he'd want to take that credit as an honorary nurse. But certainly, he actually leads on this quite a lot. And I think what we can do collectively around supporting staff, around allowing them to feel the ability to speak up, to to raise concerns, to feel that they're being supported in their education and development, that they're being appraised, that they're having their PDRs, etc., is so important. It's absolutely so important. But we don't get it everywhere. And I just thought it was worth just highlighting a couple of areas. Those of you how many of you are from London? Okay, so some of you may have seen this on the next slide. This is from the Royal College of Nursing, but I was truly horrified when I looked at these numbers. So this is London-based, but for a staff profile of 44% BME and 56% non-BME, which is the green line, you can see the difference in the percentage of staff that have investigations, hearings, dismissals, and NMC referrals. Now that's massively different. So what on earth is going on in that group of staff? And what's happening in terms of our organisations about how we're supporting those individuals, and what we're doing to actually support them so they don't get to the position where we're having to either investigate, listen, have hearings, dismissals or referrals. And if you look at the Royal College of Midwives, not quite so prettily shown, but the RCM have got a very similar issue. So the actual profile of staff, BME midwives in London, is 32%. But 60% of those disciplined were from a BME background. 33% of black midwives were suspended compared to 17 white midwives. And then, but of those that did have action, 31% had no further action taken. So a higher proportion actually had no further action taken when it was looked into and investigated as against their white cohorts. So for me, there's something significant here about what we're doing. And if you take that to the nth degree, and I've spent several, and Jean and I did this a few weeks ago, for October for Black History Month, I think I attended 4 different events. And through those, I heard some fantastic presentations, but such a shock. We've only got 2 directors of nursing in England from a BME background, and that doesn't reflect the population we serve or the population of our staff population either. The NHS Leadership Academy is running additional nursing midwifery programmes, and our plan is to put 10,000 people through those programmes over 2 years. When you look at the figures, the numbers of nurses and midwives that are being referred into those programmes from a BME background is significantly lower than the population. And so therefore those that are actually accepted onto those programmes is also lower. So I guess one of my pleas to you is, what can you as a community do to help us address some of these issues? And to actually turn what we talk about, our rhetoric, into action about we want to support our staff, we want to give people a positive experience, we want to help people progress and develop. But we need to be able to do something about this. So my request for you is that you help us do something, and actually we tackle some of these problems, and we try and get to the bottom of what on earth is going on, and we act on it. And many of you will have heard about the Klein publication, where, again, less likely to be shortlisted and appointed if you're from a B&B background, despite the fact that, your names aren't on the NHS jobs information, and doctors less likely to be awarded a high-banded clinical excellence. So quite a lot to do. So that sounds a bit depressing, but I just thought it was worth looking at, and I've talked about all of those different areas in terms of where I think this audience can have a massive issue in terms of improvement. So I want to move on and talk a little bit about back to my 60s. So I said earlier that I was really pleased at how much it's been embraced. And so this is just a picture that I found on Twitter. I could have used hundreds of photographs I've got of where I've been around the country, and people have been talking to us about what they're doing with the 6Cs. So to say it is becoming embedded throughout the NHS is, I think, maybe not going quite... I don't think it's too far to say it's having a significant impact. I was at Bradford District Care Trust a few weeks ago, and they had a great big six Cs one, which they cut into different sort of triangles, and every member of staff that you could see there gave a presentation about one of the Cs and described what work they'd done. And that some of that was in maternity, child health, some of it was in community nursing, some of it was in mental health nursing, some of it was in LD nursing. But it was absolutely brilliant. And we also had some students there who came and talked to me about what they thought what it meant to them as student nurses, and how the 6Cs had influenced them in terms of their approach to care. I've also seen the 6Cs on the front line, literally. So not only am I privileged enough in this job to go around the country and meet lots and lots of people, which is a huge privilege, I also went to Afghanistan. And this is a picture of me in Camp Bastion. Our comms team said they were very sad I didn't come back with a picture of me wearing full body armour, although I did have it. But we didn't actually it wasn't like that. I didn't really get that opportunity, and that wasn't the point about me being there. The point was to meet the nurses and medical teams that were over in Camp Bastion. And I spent quite a lot of time with clinical staff from Denmark, from America, and from Britain, from the UK. And it's Camp Bastion is led by the British, or it was the time I was there, it was led by the British clinicians. And I saw some of them knew about the 6Cs, obviously the British ones did, but I saw the care and compassion that they had in that place. It was absolutely amazing. I saw young nurses that were reservists from London that were supporting a child who'd had both his legs blown off after stepping on an IED. Didn't speak any English. I watched her communicate directly with him, eye contact to eye contact, an interpreter standing next door talking. I watched the nurses in the ward caring for soldiers that were injured, and literally in the bay next door caring for prisoners under armed guard who had been the ones that had been laying some of those IEDs and actually, I suppose you could say, were the enemy. I watched the competence, the care, the professionalism of those staff. It was absolutely amazing, and I came away truly blown away by just the whole of they really were 6Cs in action. The other thing I really like to do is demonstrate the positivity that there is out there. So I was at the Nursing Times Awards last week or the week before. These are the winners, and just the joy on people's faces when they get recognised. The joy on their faces when somebody says, "We heard your story and you did a good job, and actually we are awarding you for that good job," was just brilliant. And so I'd say when I talk to teams, please put yourselves forward. HSJ Awards are next week. Hopefully we'll do the same. The caremakers, how many of you heard about caremakers? Good. We've got over 300 caremakers now, I think. Maybe it's going up. We will get over 1,000. Sam's in the room. Thank you. Nice to see you. Caremakers started in December last year. We had 50 that were present at my CNO conference, my first CNO conference. We've been gradually expanding them. The caremakers are student nurses, newly qualified nurses, and more recently, much more experienced nurses. We've also got a physiotherapist, and we are expanding it maybe to some healthcare assistants and other staff. And I think we've had one director of finance that heard a presentation about the 6 Cs and caremakers and has asked to become one. So you never know, we could have some non-clinicians, anybody that's interested. But the principle behind this is that the caremakers are the ambassadors of 6 Cs. They're ambassadors of compassion in practice. They have done an amazing amount of spreading the story, spreading the news, talking to colleagues at universities or in their clinical placements, actually really building that cohort of the nurses, predominantly the nurses of the future, but also the staff that are there now, helping to influence culture and change. And it's been, I think, an amazing success. And every time I meet the next cohort of caremakers, you cannot help but be overwhelmed by their commitment, positivity and enthusiasm. And some people say to me, well, it's okay, isn't it, because they're new and they're going to have all that beaten out of them as they go through their career. And then you just say, well, if you have that sort of attitude, then probably then it becomes a self-fulfilling prophecy, doesn't it? But actually, if you've got a cohort of people that can support each other, and as Helen Bevan has said, rock the boat but remain in it, I think it's got really, really good opportunities and really good legs, really. The sixtieslive website is up and running. It allows people to sign up and pledge. It allows people to become 6 Cs champions. There are opportunities to look at weeks of action, and we've got a range of weeks of action coming up over each of those action areas I talked about earlier. There was one a couple of weeks ago about the public health aspect, and we've got a few that are running through till March. So you need to keep an eye out for them, get stuck in, join the webinars and really contribute to them. But one of the best things about this is it gives an opportunity for people to put their stories together. So we have every month a story of the month, and the idea is that we ask people to submit stories about how they've implemented the 6 Cs in their organisation or in their service. And they are judged by a panel which includes the Nurse of the Year, a patient, Nursing Times editor, and a couple of my staff, I've had people ring me up and say, it's great, but we have to have tissues because some of the stories are so moving. So this is the first one. Catherine is a ward sister in the Midlands, and she got awarded the Story of the Month for the first month for the care she gave to a patient who was terminally ill. His daughter was pregnant, and they knew that he would not survive long enough to be able to see the birth of his grandson or his child. They didn't know what the grandchild was at that point. So Catherine arranged for a 4D scan actually, to be done of the baby. Normally only done privately. Arranged for it to be done at no cost. They then arranged for the family to come together and to be shown the film. So the gentleman was able to see the scan of his grandson, to get as close to sort of touching, feeling and seeing a fantastic image of his unborn grandchild, which he would never ever have been able to do. The impact on that family was just significant and amazing, and they have gone back to talk to the ward sister and the staff many times since. And then she also arranged, together with the community nurses, for him to go home and to be cared for at home until he died. So you could say, well, that happens a lot, and it probably does, but we don't talk about it, and we don't tell people, and we don't share some of that extra effort that can be done but can have such a lasting impact on somebody at such a difficult time of their lives. In September, we had some community nursing teams, so the community nurse, the continuing care nurse and the play specialist, who have spent a considerable amount of time supporting Ollie. Ollie has been in and out of hospital all his life. He's got multiple health problems, but the family actually recommended this group to go forward for the award. And the care that they give him, the play specialist helping Ollie to cope with the multiple hospital visits and care needs he's got, teaching the family how to care for him at home, supporting him in his school. All of those things has meant that that child has as near to life, normal life as possible, and was a brilliant example. And then the third one, the latest one, is the day unit at the hospice up in Preston. And this team noticed that a lot of the visitors to their day unit were quite young, and therefore had young family that were linked to them. And what they did there was they arranged some days at the weekends where they got, so they had an extra day which they did in their own time, where they brought the kids in, and they linked it to games and to play, and so they linked it to certain Easter or Christmas or Diwali or whatever, different types of sort of festivals of different sorts. And they made it fun for the kids, but also gave them an understanding about what happened, and allowed families to be together at what is obviously quite a critical time. Now, I can't do justice to the full story, but the care and compassion and that extra mile that they went was really significant. I want to show you a film now, and I've nearly finished, you'll be glad to know, but I want to show you a film that I think is really important. Some of you may have seen it. It's based on the film that was done by the Cleveland Clinic in Ohio. And you look at the film and you think, if I was in their shoes, see what they see, hear what they hear, feel what they feel, you look at patients in a different way, and does it have an impact on how you behave? So if we play the film, and then I'll finish off with one more slide.
I'm at the hospital. Jane's had a fall. She's still unconscious.
I've been dreading this appointment.
I hope Steve can remember me today.
You've got the all clear. That's wonderful, Dad.
We need to refer you to the surgical team for further investigation.
I just want to take her home now.
I am going to beat this.
Still waiting. It's been 3 hours now.
Going to see Dad. Maybe the last time.
Cancer-free for 7 years.
I can't take this in.
I had to deliver some bad news today.
£6 a.m. this morning. Yeah, he's £8.
I'm sorry, Mrs. Benson. There were complications with your husband's surgery.
So for me, the point about that film is whatever job you do, whether you're a commissioner, whether you're a provider, whether you are somebody that actually works in an organisation on a day-to-day basis, every member of staff, every patient has got a story. And if we put ourselves in those shoes and we understand, actually I do think we have a different perspective on how we treat them and how we treat each other. And I want to end with this last picture. This is a picture of my husband, Chris. Chris had acute lymphoblastic leukemia and died 7 years ago. He was treated actually around the corner from here in Bart's Hospital for a long time and very well. And one of the things he said to me was, if I die, I want to die at home. And can you promise me that you will take me home? And it was a bit touch and go at one point, because when his leukemia came back, the Bart's Hospital said they weren't sure whether he would survive long enough for me to actually get him home. But I did take him home, and I looked after him at home for 6 weeks. And I couldn't have done that without the GP, the community nurses, the Macmillan nurses, and the support of my employer at the time. And if there's one thing we can get right in the NHS, it's actually caring for people at the end of their lives and their families. And you can't go back and say, I'll do it better next time, because for that family there never is a next time. So if there's one thing that gets me out of my bed every morning and doing the job I do and the passion I've got for working in this wonderful NHS, is to make it the best it possibly can be for all of our patients and for particularly those at the end of their lives. So you can help me do that. Thank you very much.